Hello everyone, and welcome back to our channel. Today we're diving into a super important topic, concussion assessment. Whether you're an athlete, been in a car accident, or just someone who wants to stay informed, this video is for you. So let's get started. First things first, when assessing a concussion, we start with the patient's history. This means discovering how the injury happened and reviewing their symptoms. And what type of fall was it, or did they hit their head? We always have them fill out the River-Mead post-concussion questionnaire. The history is essential also to rule out any other possible explanation for the symptoms that they're having, like dehydration or some other medical condition. Now, let's talk about the signs and symptoms of a concussion. These can vary widely, but often include headaches, dizziness, confusion, nausea, sensitivity to light or noise, and balance problems. Some people may experience blurred vision, memory loss, difficulty concentrating, and changes in mood like irritability or sadness. Recognizing these symptoms early is crucial for proper management and recovery. Next up is the SCAT-5 assessment. This test is crucial when a concussion is suspected. But what exactly is the SCAT-5? Let's break it down. SCAT-5 stands for Sport Concussion Assessment Tool, 5th edition. It's the gold standard for evaluating concussions and is widely used in both sports and medical settings. The SCAT-5 is divided into several parts to give a comprehensive assessment. Let's go through each section. First, we have the symptom evaluation. The patient is asked to rate the severity of 22 different symptoms, such as headache, dizziness, difficulty concentrating. This helps us understand the patient's current condition and track the changes over time. Next is the cognitive screening. This includes orientation test, where we ask the patient simple questions like date, time, and place to assess their awareness. Then there's the immediate memory test, where the patient is asked to remember a list of words. We repeat a list of several words several times to see how well they can recall it. Then comes the concentration test. Here a patient is given tasks like reciting the months of the year in reverse order or repeating a string of numbers backwards. It's all about seeing how well they can focus and process information. Finally, there's the delayed recall test. After about 5 minutes of other activities, we ask the patient to recall the same list of words from the immediate memory test. This helps us evaluate their short-term memory retention. The SCAT-5 is a thorough and reliable tool for concussion assessment. It helps us get a complete picture of the patient's cognitive and physical state after a suspected concussion. Now, let's move on to the next step, the cervical spine evaluation. Here we check neck movements and see if they provoke any symptoms, such as headaches, nausea, dizziness, or anything like that. We also perform orthopedic tests, assess ranges of motion, and do a neurological assessment. Take x-rays and order other diagnostics like MRIs. This is to ensure that there is not a cervical spine injury and a component. Balance is a big deal when it comes to concussions. That's why we use BEST test, or Balance Error Scoring System. This helps us measure postural stability and balance accurately. Next on the list is the VOMS test, Vestibular Oculomotor Screening. This is one test is fascinating because it checks how well our systems integrate balance, vision, and movement. The eyes can tell us a lot about a concussion. During the pupil exam, we look for changes like uneven size of pupils, dilated pupils, constant dilation or constriction. Other visual symptoms can include misaligned eyes, difficulty tracking objects, droopy eyelids, nystagmus, which is rapid, uncontrollable eye movements. Memory and cognitive functions are also affected by concussion. That's where the impact test comes in. The impact test is a computerized test that measures memory, attention span, and problem-solving skills. We can even use it to later evaluate the patient and track their progress. After all these examinations, the practitioner can review the findings to make crucial medical decision-making. It could involve ordering other tests like MRIs or CT scans, or referring to a neuropsychologist or neurologist, and making treatment recommendations. And remember, if you suspect a concussion, it's essential that you seek medical help immediately. Thank you for watching, and don't forget to like, subscribe, and hit that notification bell for more informative videos. Stay safe, everyone.